Okay. Okay. Good afternoon, everyone. We will begin this session shortly. Allow me to go over the house rules and SOPs of this afternoon's session. First, kindly keep your microphones muted when you aren't speaking to avoid any unwanted disturbances. Second, kindly use the raise a hand function below when you'd like to speak during the guided discussion so that our moderator can call on you. And lastly, feel free to leave your questions in the chat box so that our team can prepare them for this afternoon's guided discussion. And that will be done at the end of the session. And this session is being recorded and live streamed as well. Thank you. So I would like to welcome everyone to this afternoon's event where we will be talking about youth innovations for mental health, brought to you by the Social Enterprise Lab. In today's discussion, we hope to have a better understanding of how the Sangguniang Kabataan, senior high schools, and students undergoing the National Service Training Program might provide leadership beyond the typical research and teaching, and how thousands of students may serve as catalysts of innovation in mental health that transitions at the city, the national, and transnational levels. Topics included in this afternoon are about social entrepreneurship, design thinking, youth governance, social lab platform, governance innovations, NSTP and SHS research, DepEd, and CHED initiatives. And I will be your facilitator this afternoon. I'm Lara Aquino, a representative of the Emotional Reset Center, which is one of our collaborators for this event. And the ERC is headed by Dr. Maria Bryce Fabro, who is the founder and chief inspiration officer. Now, without further ado, I'd like to turn over the virtual stage to Dr. Elmer Soriano, the co-convener of this Social Enterprise Lab. He is the CEO of Civica Asian Development Academy. He has 20 years of experience in leadership, management consulting, and knowledge management in the development sector, advising corporations, nonprofits with projects in Southeast Asia, South Asia, North America, and Africa. He has developed program strategies for various development issues and sectors. He provided leaderships in projects promoting innovative solutions and services in various sectors, especially in the informal sector. He graduated from Harvard University, John F. Kennedy School of Government in Cambridge, Massachusetts, USA. So everyone, let us all welcome Dr. Elmer Soriano.
Hello, good afternoon. Thanks, Lara, for that introduction. I'd like to welcome all of you to this afternoon's session. Let me just share my screen. So this afternoon, we'll be talking about what the youth can do in terms of mental health and how we might be able to work with SKs and universities in addressing mental health problems. Okay, so there are a few opportunities in the next few weeks or next few months for us. No? There are a total of 1.4 million individuals who filed for candidacies. That includes SKs, barangay candidates, no, and little over 0.6 million, 600,000 will get elected. We have 42,000 barangays, so that's a lot of people. That's a lot of people, and then when they get elected, our elections will be in October 30. So they are about to start their campaigns, and all of them will have to have an agenda. No? And I imagine that a few thousands or a few tens of thousands of them, pwede nilang i-agenda ang mental health and youth innovation. And yun yung papag-usapan natin ngayon. There's that opportunity to address, to harness the capacities, all of these tens of thousands, hundreds of thousands of leaders to become leaders for mental health. Yeah. On the other hand, there are 3.6 million Filipinos suffering from mental health. No, so this is a widespread problem. Lahat tayo may kilala tayong may nahihirapan sa mental health, either a family member, kabarkada, o siguro some of the audience meron din ganon, no, nakakaranas ng mental health challenges. So it's a large-scale problem requiring a large-scale solution. And we feel that the network of barangays, SKs, barangay kagawads, and schools and universities can be part of this solution. Ngayon, ano yung Social Enterprise Lab? No? This activity is organized by the Social Enterprise Lab. And many of you might be thinking, ano ba yung social enterprise niyan? So social enterprise, basically negosyo, no? Or business, pero it attempts to earn money by solving the problems of the real-world social and environmental problems. Ibig sabihin, negosyo ito na nagsusubok na maging solusyon sa social or environmental problems. That's one general definition. And we'll go deeper into that later. Si Sir Kevin will explain that. Ngayon, ang Social Enterprise Lab is a school-based program or a set of projects that solve real-world social problems. And in this case, papag-usapan natin how school-based teams can try to solve mental health problems or mental health challenges. Ngayon, there is growing recognition of the power of social entrepreneurship. In fact, earlier this month, no, September 5, LaSalle and Ateneo agreed to team up to promote social entrepreneurship through their universities. And to us, this is a sign na nagiging mainstream, na nagiging advocacy na, and that more and more universities and schools can follow suit now that they see that the big players are taking this up as an advocacy. And related to that, no, our organization, Education Development Academy, and our other programs have had experience in harnessing thousands of students, individuals through universities. So a few years ago, we had over 1,000 masteral students working with us through 11 universities all over the country. And they were working in over 1,000 municipalities. The students were enrolled in masteral programs, masteral courses, which we taught to the universities, and they were implementing projects, real-world projects in their municipalities. No? So naalala ko, ang isang assignment namin sa mga students dito is dapat may selfie sila with the mayor as proof that they were actually engaging the mayors in their project. No? Kasi kasama sa project nila ay makipag-partner sa munisipyo. And this kind of platform, no, working with universities, working with students to do real projects, no, hindi lang yung project na sinusulat, kundi project na ginagawa, ini-implement, scalable, highly scalable, and it can become a real solution. Here's another example. In this case, I was coaching the mayor. So on one front, I am also involved in coaching of mayors and governors and other leaders. And I was coaching this mayor in Anilao, Iloilo. And ang major problem nila, they had the highest teenage pregnancy in the province. So problema niya yun, teenage pregnancy. So sabi ko, magpatulong ka sa nursing students because nursing students have a required community nursing program requirement course. No, they do field work as community nurses. So that's what she did. And here there's a team of nursing students that did a survey and an analysis of the teenage pregnancy program in their municipality. So there's just one student in the photo here, pero actually team sila. No? And then they're presenting their findings to the municipality para pakinabangan ng munisipyo, the decision makers, the city council, the municipal health team, yung insights ng students. No? And of course, the students were being advised by their professors. So napapakinabangan ng munisipyo through the students yung advice ng professors. Here's another example of a lab we set up with the support of UNICEF. Here, mental health. No? These are senior high school students, grade 11 and grade 12, and we asked for the mayor, from the mayor, that priority problem set of this municipality. This is in Sultan Kudarat in Mindanao. Ito yung mayor, the guy in black is the mayor. No? And ang problem nila is mental health and childhood malnutrition rin. They had a high malnutrition rate. And in terms of mental health, it was very real to them kasi the year before, one of the students in this senior high school did a completed suicide. No? So it was a very real problem, upperclassman yun to these students here. So there were a number of student teams that worked on mental health, stressors among teens in their municipality. And here they are reporting their findings. And this is what we think a social enterprise lab could look like in the many different municipalities all over the country. No? Where student teams are reporting their proposed solutions to the municipality. And then some of the solutions could become programs of the municipalities. Some of the solutions could become enterprises, no, negosyo ng teams. No. Itong project na ito actually was convened by the SK, Federation of Calamansig, Sultan Kudarat. So itong forum na ito was organized by the SKs, and with over 300,000 SKs na ma-elect next month in October, pwedeng ito yung itsura ng isa sa mga projects nila. So yeah, no, ang nangyari dito is in the research forum, in the forum where the students are presenting their findings and recommendation, nandun yung mayor, the municipal health officer, the college campus director, municipal social welfare development officers, and then the local youth development officer. So yung research ng mga estudyante, hindi napapakinabangan lang ng teacher. Teacher lang nakikinig, and then bibigyan sila ng grade, tapos na. No? In this case, it becomes a real input to the municipal decision makers. No? And we would like to see thousands of similar research forums through the lab projects where the research work ng mga estudyante, whether senior high school or college, ay napapakinabangan ng munisipyo. That's in cities. Yeah. Here's another example. Here, these are undergraduate students in Quezon City convening a policy brown bag discussion with the city itself. No? So they were discussing LGU University collaboration, and these are students, no, where they convened academics dito. I think this was one of the senior professors. And then there's a representative of the city government. So students can also be conveners, no, in these things. And therefore, pag nagko-convene yung mga estudyante ng ganito, nagiging advocacy conversation yun. So we imagine that over time, there could be dozens, if not hundreds, of social enterprise labs hosted in universities, and that it becomes a platform, and they can start sharing notes such that, say, the solutions produced by students in Tarlac can be accessible to students in Zamboanga and to Tuguegarao and Davao. Tumawid yung mga insights and lessons learned and ideas from one university to another. And we hope that there will be a network of social enterprise labs all over the country over time. So why should students and SKs and universities activate social enterprise labs? No? One, we feel that it is leadership and citizenship development. No? So when students have an opportunity to engage in research and enterprise development and then pitch to the municipal mayor or to the city councilors, then nakakaranas sila ng leadership and citizenship development. And then second, participatory local governance. It also improves local governance at the city or municipal level kasi napapakinabangan ng munisipyo yung talino ng mas maraming tao. And then there can be real social impact. For example, pag may mga estudyante na nag-research on mental health, it is possible that there could be real mental health projects at the school level na talaga mapapakinabangan kaagad ng mga estudyante. Number 4, this is also a form of educational reform. Basically, nagle-level up rin yung educational experience ng mga estudyante and therefore nagiging mas exciting at mas malalim yung natutunan ng estudyante pag may mga social enterprise labs sa kanilang munisipyo. Number 5, nagiging mas makatotoo, no? The schools and the students will begin to appreciate that through their actions, they have real contributions to the community, no? So hindi lang to rhetoric, no? Hindi lang to sabi-sabi, kundi nagiging totoo na contribution to the community. And then later on, pag marami nang gumagawa nito, then and then if their outputs are shared online through social media, then yung natutunan nila kahit na sa school nila, sa student project nila, pag share nila online through YouTube or Facebook or TikTok, then posibleng pakinabangan ng a broader community of learners working on, say, mental health. So that's the vision for the social enterprise labs, and we're hoping that SKs and universities and senior high schools use the social enterprise labs as platforms for advancing para magkaroon ng ganitong storyline sa iba't ibang munisipyo all over the country. Thank you, Lera.
Thank you so much, Dr. Elmer. Amazing. All right. It definitely gives us an understanding of the larger context of how social enterprises help solving ongoing challenges and how the youth can play a big role in this endeavor. Now, let me introduce to you our next speaker, who will share more about leading social enterprises. Mr. Kevin Martin de la Cruz has been working in the development sector for 12 years, assuming various roles as a social entrepreneur, government consultant, lecturer in enterprise development, and program development manager. He is currently working full-time as a lead consultant of Strago Solutions Consulting, working with both the public and private sectors on social enterprise, development, and program sustainability. He ran workshops and conducted research for over 80 organizations, both locally and internationally. He also worked as an entrepreneurship and incubation manager of the Philippine Development Foundation, where he was able to run 8 incubation and acceleration programs, providing technical support and mentorship to over 100 startups and social enterprises. He is an alumni fellow of the Young Southeast Asian Leaders Initiative Professional Fellows Program year 2017, organized by the U.S. Department of State, wherein he was elected to represent the Philippines to work with a management consultancy firm in Washington, D.C. He was awarded by Meg Magazine as one of the 30 under 30 youth movers and achievers of the Philippines in year 2013. He was also one of the finalists of the ASEAN Startup Awards 2020 as the Startup Ecosystem Hero of the Year. He is also the immediate past president of JCI Quezon City Luna, wherein he continues to support community enterprises and SMEs in his pilot programs with the Quezon City government. He is currently taking his master's in public management at the Ateneo School of Government. Let us all welcome Mr. Kevin Martin de la Cruz.
So thank you very much for the introduction. That's very generous. And thank you again for the invitation to be able to share this afternoon. So I've prepared some slides for me to talk about, to give an overview of what social entrepreneurship is and how does it enable innovation. How can it become a tool to enable innovation, specifically in social impact and social development. So let me share my slides. Yeah. So coming from Dr. Elmer's presentation earlier, no, so we can see that he identified that it's important that there's a coming together of minds to enable innovation. At the same time, there should be coming of different minds from various backgrounds. Yeah, so it's not just a collaboration, no, but ultimately even people from various backgrounds, no, to come up with an innovative idea, eventually, which will eventually lead to an innovative project. But what he's saying is social entrepreneurship is a tool, is is an entity that can help us create sustainable development. So let me share with you how can that happen, and perhaps you can consider it in the development of your respective projects. So let me share with you, what social entrepreneurship is all about, just to give an overview. Um, Social entrepreneurship is actually a response to a social problem, meaning it's not just an entity that's set up just for us to have profit, or just for us to innovate on a certain product or service, but the root of the response is more important. Meaning, what is it trying to solve? What sustainable what problem are we trying to respond to with a sustainable solution? So it really starts with what's the social problem? Can be environment, can be education, but for the benefit of this challenge, it's mental health. Then, given all the solutions on mental health as a social problem, how do we respond to it in a different way, which is through innovation? So, an innovative way to do it is perhaps to develop a digital application, or for us to develop a peer group, for us to respond to cases of depression in universities, in different institutions. But innovation is there's another layer that needs to be added so that we can say that, okay, we the innovative response can be sustained, and it's the business part. So business is not just about earning money, but mobilizing enough resources, human, financial, institutional resources, so that the innovation can be continuous, so that the social problem that can happen even in the future can be responded to, can be, you know, the innovation can last for a long, long time. So there. So social entrepreneurship is a combination of these three. That with the use of with the tools of innovation and business, we are combining them to respond to a complex problem. There. So social entrepreneurship, by definition, it involves a financially sustainable earned income activity. Yan. So I already said, no, na there's a need for us to earn. Okay, why? Because actions, every step that we're taking as advocates require money, right? I mean, even in developing programs, even in being in let's say in renting a room, simple as that, no? Those things, no, for innovations to happen, we need finances, we need money. So that's the reason why it's important that we have that earned income aspect in our innovation. The next is it sustains the social impact and reduces donor dependence. Because yes, we know that there will be supporters in through government, through through grant giving organizations, but by creating a business model in the process, no, we are sustaining ourselves. We are sustaining the the business so that we can sustain also the operation of the innovation there. Then third is it's not an ordinary business enterprise because social enterprises are of course focused on solving the social problem. Because for business enterprises, for those who have business background here, no, its emphasis is okay, how do we best provide um products for the market? I mean, what's the best market centered product that we can generate? But here, it's not just that we're considering. How can this market centered product or service or mobile application will be able to eventually solve the social problem? So we can say that social enterprises have a higher calling, so to speak, as a business when it comes to its development. There. So for instance, no, Homs, so the problem that it plans to solve is accessibility to well, it's technically poverty, no, but it's focused on accessibility um to school supplies or in preparation it's helping students, young people, no, in Africa to have shoes whenever they go to school. So that's where they started, the founder of Tom's. So what the founders are doing, what the founders have been doing and up until now is for every pair of shoe that we're buying, proceeds of it will go to the investment for a pair of shoes of a student in Africa so that that student can walk to school properly, no? So hindi lang sila nakapaa. So ganun lang kasimpleng solution ng Toms, no? So in a way, it's still earning technically as a business. It sustains itself as a business, but through the money invested on the shoe, it it enables the organization, the business, to contribute to the problem of lack of resources in African areas. In fact, Toms has expanded to other countries as well. So what makes it different from other business enterprises? Well, it's multiple bottom lines. We're not just focused on profitability, but also are we hitting the vision, the social development vision that's that you're trying to solve. So that's the reason why you're trying to balance. No, you need to earn so that you can sustain your innovation. At the same time, you need to solve the problem per se. So yeah, so we don't want to be just we don't want to be a non-profit which depends mostly on grants, and we don't want to be a full-fledged business that's focused on earning, generating income. So we want to strike the balance. Then partnerships, we don't see anyone as competition. We see people as and organizations, even other businesses as partners for change. And then usually social enterprises supports and collaborates with a certain community to make it happen. So the reason why there's always a community partnership because usually we want to involve people in the development of the innovation or in the product or service so that they can also earn or they can also be part of the group na may impact ng certain social enterprise mo there. So, all right. For the multiple bottom lines, okay, I still have 5 minutes. No? Ayan, so people, profit, and environment. Okay, so people, for let's say for mental health, no, it's the recovery of people from episodes of depression. It might not be total recovery, but it can be their episodes of depression given your solution. Another indicator that we can target is how many young people have access to psychotherapists, to counselors in a particular area, given, let's say, your digital solution or given your service. I mean, it depends on what you will be thinking. So those are the things that you'll have to hit as a social entrepreneur. Then profit, um, in what ways will you be generating income so that you can have funding to pay the counselors that would be rendering service to the students, or perhaps if it's a facility, if it's a service that you're trying to develop, no, how will you be able to pay for infrastructure there? As simple as that. Meaning, if you have a facility, no, in a public school or in an or in a private school. It depends, no? How will you be able to compensate for the overhead costs for that? So profit is needed, no, to pay for those, and eventually paying for yourself as the leader of the social enterprise. Then for the environment, well, it's an added bottom line, because we don't want to disrupt the environment while we are doing social change, because that will be uh, that that will negate what we're trying to do for change. I mean, we're destroying the environment while saving people from mental health problems. So, so it's important that we consider the environment in the way we do our operations. There. So, for instance, Bambike, um, it is famous as a social enterprise, given its advocacy in helping communities have livelihoods, specifically the communities in Tarlac, um, in developing the bamboo frames in the bike. So the income that the people are getting from developing those bamboo frames help them, no, um, in their respective needs in their families, no. At the same time, the product promotes Filipino-made bicycles, and it also promotes green tourism, because most of the parts here are not made from, you know, mostly yung carbon footprint. I mean, it promotes healthy lifestyle. Then it's not made of products that will cause pollution, since it's made from bamboo. Most of the frames, of course, is made of bamboo. So we can say that it it's earning at the same time. It's helping people and helping the environment in terms of promotion of lessening the carbon footprint generated by people who are not biking. So there. The bikes are relatively expensive though, because of the way the bamboo frames are made. I mean, it costs a lot, but truly, no, it's an investment that's not just for you, but it's more of an advocacy for others to see. There. So some insights, no, quickly, no. Have 2 minutes. So insights on social enterprises. So given that framework, no, that perspective, okay, how can I develop a social enterprise to respond to mental health concerns? Okay, so number one is the heart of the initiative is in the community, meaning it can be the community you're supporting, it can be the community you're partnering with. So it's not about you as the entrepreneur. I mean, there are a lot of entrepreneurs now na the focus is to be featured, etc. No? Pero dito sa social enterprise, no, the goal is for us to, bring to the spotlight, no, the how can they be they how can they you know to find resolution to their conflicts, to their troubles, no. So let's say students who might have depression, eventually, given your solution, they didn't just recover, but they're also the ones healing others. So yon. So it's really all about them, not about the entrepreneur, not about the profit, but it's really about the impact that you're going to be making. Then next is the vision of any project should be a shared picture of progress. So it's about how can when we say profit, it's not just the earning of money. Profit is impact, meaning you are improving as a social enterprise if you are hitting your development outcomes o yung main reason nyo why you are establishing the business. Are doing the innovation. Yeah. Then entrepreneurship is a mindset that leads to prosperity. It means, um, yes, when you say prosperity, no, it's entrepreneurship is not just about money, but it's also for ano yan eh, as you are running the social enterprise, you're thinking, how can we do better in what we're doing? So it's a continuous development, seeking of solutions. Yeah, and if I may say. So that's the beauty, no, of bringing entrepreneurship in innovation, because you're trying to seek for new ways to do things, no? not just to solve the problem, but getting resources to solve problems for more people. And the good thing about the entrepreneurship model is when it becomes quote unquote a franchise. Let's say you develop it in Albay or in a municipality. So perhaps you can bring it to other municipalities, make branches, and then you are getting more staff to replicate the solution. So that's so the entrepreneurship mindset no leads us to possibly um maximizing the resources towards funding no the solution. Then maximize the potential, minimize the external. So meaning you maximize the potential of the people. Okay. So it means you don't have to think too much um the donors that are I mean may donors na darating pero isipin mo ano yung meron tayo na pwedeng gamitin natin to develop the innovation. So yun yung isipin natin. Think about our capacities, the capacity of the community, the capacity of the mental health champions that you have in your school or institution. Next, the pursuit of people improvement is sustained by business development. Okay, so we grow as we do the business, and then the business of doing good focus on partnerships, not on competitors. To reflect on what institutions in mental health we can work with. Okay, so perhaps the solution might not be so unique, but we can co-develop it with them because they've already gained traction as far as piloting the solution is concerned. Then, the expansion of the market is defined as a propagation of the cause. It means habang dumadami ang gumagamit ng produkto at serbisyo mo bilang social entrepreneur, you are also getting more advocates to the cause. And that's the good thing about social enterprises because it uses the marketing model, which is technically becoming what we call social marketing, okay, to spread the word, not just get new clients to pay for your service there. Then the profit in a social enterprise is the impact you make in the community. Okay. So it's I emphasized it earlier, no? Then complex problems call for creative and collaborative solutions. So you need more heads, you need more institutions to work with you. That's the reason why we have the social lab. Now you need to tap different brilliant minds from the academe, from government, students, even the community, youth champions, marami, no? So there's so much potential in what you will be doing. So, and the model of social enterprise can transform any institution to be better in doing good. So it can, I mean, if you're, let's say, a sangguniang kabataan, no, member of an SK, you will have this, I mean, you might not be successful, let's say, in really starting a social enterprise, no, kasi it might take some time. Pero if you have that mindset of really balancing different things, no, resources, yung impact na nagagawa nyo, no, parang na-sharpen kayo. You're actually developing yourself to become better innovators in your respective community, in your respective field. There. So that's it, no? So those are insights, no? So I hope that you can consider that in the development of your solutions. There.
Thank you so much, Mr. Kevin. Thank you for that deep dive in social entrepreneurship. And I am confident that our participants understand more what it means to start a social enterprise and how to sustain it, and how innovation plays a big role in this. Thank you so much. So for our next speaker, who will share more about the mental health crisis and the ways to battle it, we have Dr. Carlo Alfonso Belmonte. He is a board-certified psychiatrist. He got his nursing and medical degree at the University of the East Ramon Magsaysay Memorial Medical Center. He took his residency training in psychiatry at the National Center for Mental Health. After residency training, Dr. Belmonte became the program coordinator for the NCMH Crisis Hotline. He was instrumental in streamlining and improving the hotline services. He was part of the team that brought one of the leading programs in suicide prevention in the world to our country. Applied suicide intervention skills training and safe talk from Living Works Australia. During his tenure, he helped create linkages with mental health professional organizations and advocacy groups in the country. He spearheaded the development of the Telemental Health Program in partnership with the Philippine Guidance Counseling Association during the pandemic to provide mental health psychosocial support to NCMH hotline callers. He worked with the Commission on Human Rights to develop the training module on the rights to mental health for faith-based organizations. He is a staunch mental health advocate and has been a speaker in various public health fora. He is taking his master's in development management at the Asian Institute of Management. He is a medical specialist at Bicol Regional Hospital and Geriatric Medical Center and consultant at Recovery Hub and MetroPsych. Everyone, let us all welcome Dr. Carla Alfonso Belmonte.
So good afternoon, I'm Dr. Carla Belmonte, and today I am going to discuss mental health in the post-pandemic era. So the psychological impact of the pandemic opened our eyes to the importance of mental health in our overall well-being. So according to the WHO, the COVID-19 pandemic increased the global prevalence rate of anxiety and depression by 25%, with younger people and women affected the most. We are now experiencing the long-term sequelae of the pandemic, and research has shown on the post-pandemic psychiatric implication on COVID-19 in South Korea showed a significant increase in depression, anxiety, psychological distress, suicidal ideation, and suicide rates. So in the context of the Philippines, we face a stark shortage of mental health professionals. We have 0.52 psychiatrists, 0.07 psychologists per 100,000 inhabitants, and the need for intervention is clear with this dearth of mental health professionals. We must promote advocacy, awareness, mental health literacy to bridge this gap effectively. When the pandemic struck, a call to action was made, leading to collaborative, multidisciplinary, and multisectoral approach to mitigate the psychological footprint of the pandemic. The pandemic allowed the development of innovative, cost-effective interventions that made mental health services more inclusive and accessible to the population. Our public health response placed mental health literacy at the forefront, aiming to reduce the pandemic's psychological footprint through education, self-care promotion, improving coping strategies, and enhanced family support. Now let's turn our attention to the mental health innovations and initiatives that have taken place in the Philippines over the last 3 years. So telemental health has emerged as a crucial avenue for providing psychiatric consultation and psychotherapy, transcending geographical constraints and expanding access to mental health services. So the private sector has primarily introduced evidence-based mental health programs such as mindfulness-based interventions and animal-assisted interventions to provide diversity of mental health treatments available in the country. So the National Center for Mental Health crisis hotline services have been reinforced as well, and efforts to establish other crisis hotlines across the country are in place. So the DOH retained hospitals have been tasked to establish psychiatric clinics and acute psychiatric units to provide specialized care in in far-flung communities. Likewise, the DOH introduced the Lusog Isip mental health application, offering valuable resources and self-care toolkit. The Commission on Human Rights has introduced workshops on rights to mental health for various community sectors, including faith-based organizations, local government units, security sector, and the academia. So mental health advocacy groups and foundations like Mental Health PH, Unilove Foundation, have played pivotal roles creating self-care toolkits and offering training such as Race Against Suicide, respectively. There has been an increased focus on screening of 4 mental health disorders in schools and in universities. Lastly, across the Philippines, various local governments units have established community-based programs to make mental health services more accessible in their respective communities. So in conclusion, the COVID-19 pandemic highlighted the critical importance of mental health, creating an urgent need for expanded services and support. Mental health initiatives and innovations reflect our collective commitment to building a mentally healthy, resilient community. Let's continue working together, advocating for mental health awareness and ensuring that everyone in our country has access to the care and support they need for their mental well-being. Thank you very much and good afternoon once again.
All right. Thank you, Dr. Carla. That was informative and inspiring. It helps us realize how much we still need to learn and do for the mental health space. I will be sharing a short video to show an overview of a mental health hackathon held in the UK. And to explain it further, after the video, I'll call on Dr. Elmer. So for now, let me share the video. Hold on.
I come here today to see mainly what young people are thinking, like what are their views on mental health, you know, what do they see as the problem, and also it's interesting to see people coming out on a Saturday, young people coming out on their Saturday early in the morning, coming to Cambridge to do this, to talk about mental health because they want to make a difference. And days like today, they're you know, days for inspiration to meet young people and to get an idea of, you know, what's needed and stuff.
The Eastern Academic Health Science Network is really keen to get patients and the public involved in the design of services. And today is about getting young people to brainstorm ideas around mental health and come up with innovative solutions that are potentially implementable into the system.
There's a lot of denial, especially from parents, for people with mental health because of this fear that it makes them a bad person or a broken person or deficient, or because of the way it's portrayed in the media, because of the way we're taught to think about it, because we're taught that it has to be a bad thing and it should be judged and you should never accept it.
Everyone wants to be normal, everyone wants to fit in to a certain extent, and to say, you know, I'm not happy is not going with the flow, so to speak. So that for a young person to sort of be against the crowd almost can be quite hard, can be quite stigmatizing.
You know, we all have ideas about what's wrong with mental health services or what could be improved. Giving them a chance, a dedicated space, a safe space to explore these ideas, to develop their thoughts and be creative and innovative is a fantastic way for them to engage with the subject.
I definitely think like the coming up with the problem and everyone discussing that was very helpful because it's like you're hearing a bunch of different people talk about how they've struggled with it and their problems, and also moving into the solutions just through them talking about their problems. Like just you thinking, oh, that's how you can help with this or you can help with that, just by them voicing their concerns. I think that's been really, really good.
Kids aren't going to stay kids forever. They're going to be adults one day, and if we don't give them the right tools and the right knowledge to deal with mental health, or even physical health, and other things that all of us struggle with, we're not going to have a society that will be able to cope with diverse problems, and it won't be an inclusive society either.
Someone told me one of the best ways to help yourself is to help others, because helping others makes you more aware of the situation and makes you maybe aware of what's going on with yourself. And it's really good because it raises awareness of everything, and it's because like without you and your input, like things won't happen. So go out there, help others and do something.
I would like to call on Dr. Elmer Soriano to share more about the video that I just showed you, to explain it more and to give us more insights. Dr.
Yeah.
Elmer?
Yes. Thanks, Lera. So basically, ang gusto natin mangyari is, for senior high schools, for universities to have activities like this. At one level, it's about coming up with a solution. No? Yung parang brainstorming, project, data gathering. No? If it's a curricular course, no, it's a project assigned to the students by the teacher, then it's part of their coursework. No? At another level, it also creates the space para napapag-usapan tong mga to. Kasi alam naman natin na madalas stigmatized ang mental health and therefore hindi napapag-usapan. No? And creating, organizing mental health hackathons creates the space, no, na mapag-usapan to ng mga teams between students and teachers, no, as they brainstorm. Nagiging mas okay na pag-usapan itong mga problema na ito. And then at the third level, yung mga ideas na na-brainstorm mga estudyante, they can be inputs to the school administration para at the school level, they have more responsive programs, or to the city or municipality government. No? So yung mga suggestions galing sa kabataan will enrich, inform, and maging mas maganda yung mga programa pang mental health para sa mga munisipyo na yun. So yun yung vision natin, and we feel that universities, schools, and SKs and barangay officials can all contribute and create spaces like this for mental health and for other problem sets in the municipality. So yun yung we're inviting you to consider this as part of your school program or SK or barangay programs. Thank you. Back to you, Lera.
Thank you, Doc. Hold on. All right. For our last share for today, I am pleased to introduce Miss Kimberly Ante. Ms. Kimberly Ante is an Albay-based development consultant who helps local governments create innovative women and youth-oriented programs that drive participation, leadership, and good governance. She was a science research specialist for the Department of Science and Technology 5 before serving as a GAD specialist, where she advocates for evidence-based approach to mainstream gender and development in areas such as health, education, and environment. She has since worked with Tabaco City, Daraga, and the provincial government of Albay, as well as advocacy groups in schools and communities in the province since 2016. She was a Young Southeast Asian Leaders Initiative Fellow for Environmental Issues and an Impact Lab XL alumni at the East-West Center in year 2017 and 2018, respectively. At present, Kim is an Asia Development Bank Japan Scholarship Program scholar taking up Masters in Development Management at the Asian Institute of Management. Everyone, let us all welcome Ms. Kim Ante. Ms. Kim.
Hi everyone, good afternoon. Thank you, Miss Lara. My name is Kim and currently a student at AIM and also a fellow under Civica Asian Development Academy's SE Lab. So as Miss Leah mentioned, I will be sharing a bit about my experience as a Civica fellow or as a fellow under this program. So earlier we were talking about innovation in mental health for schools, institutions, SKs, and we also learned about social entrepreneurship from Sir Kevin. No? And we see this not just as applicable in mental health, as Doc Elmer mentioned, but in many other challenges that our communities or our society faces. So with the help of Doc Elmer and Civica, we students, we are doing our capstone project, and we were connected with the local government unit of Del Carmen in Siargao. And there we learned, we had different exchanges, no? Nag-uusap kami about the challenges that they face, specifically and more timely with the effects of climate change sa kanilang sa pinaka-vulnerable people in their municipality, and these were the farmers and fisher folk. So currently we are working on helping Siargao's Climate Field School. So meron silang tinatawag na Climate Field School for farmers and fisher folk. And we are there. I'm part of a team of students who went to Del Carmen in Siargao to help them design their operations, kung paano ba iraran yung climate field school, paano ba tutulungan yung farmers and fisher folk na una, hindi lang maging productive, meaning tumaas yung productivity nila sa kanilang mga pananim at sa kanilang mga huli. And at the same time, that translates kasi to increasing their standard of living, and also while creating sustainable practices, helping them implement sustainable practices in farming and fishing. Basically, the three bottom lines that Sir Kevin mentioned earlier, no, people, profit, and planet. And we are working with Mayor Coro of Del Carmen, with their municipal agricultural office, with Surigao del Norte State University, with an NGO called SICAT, focusing on developing or helping the fisher folk, and also the farmers and fisher folk themselves. So the SE Lab, no, the Impact Leadership Lab in AIM, and also Civica's Innovation Labs have been really napaka-enriching ng experience, because we get to apply what we are learning in school. So in AIM, we talk about bridging leadership, we talk about impact first investing, social entrepreneurship, and project management on top of our experiences as development workers. Pero at the same time, we get the opportunity to collaborate, to work with these partners in Siargao, working with them to uncover the challenges that they face. So yun nga, as mentioned earlier, how the labs work, the students, they talk with the mayor, they talk with the people in the community to know about the challenges, para yung mga research natin as students are more relevant, no? Hindi lang nag-iipon ng dust, no, in the shelves, but they're relevant and they can directly and immediately help these communities. So we were able to co-create those solutions with the LGU and the university, and explore ways to scale these solutions. So to talk about just a personal insight about all these processes na natutunan namin bilang mga estudyante, bilang mga fellows sa Innovation Lab, sa SE Lab, nung natanggap namin yung problema from the LGU, no, saying that the farmers and fisher folk are the poorest, sila yung pinaka-vulnerable dahil ito nga, we're having thunderstorms right now, and palakas ng palakas yung mga bagyo natin, yung droughts are increasing, ang daming problems in relation to climate change. And akala namin as a team, we needed to go there to Siargao having a perfect, elegant solution in mind already. However, nung nakausap namin yung mga farmers, yung fisher folk, nakausap namin yung mga ilang estudyante, ilang kabataan na nandoon, si Mayor and even their workers in the LGU, the more na naintindihan namin that we were not there just to present a solution, but to create a solution together. So in the process, we are learning a lot from them, and they are also learning a lot from us. We are able to contribute what we know. So I began to understand na hindi kami nandun as grantors or benefactors, but as facilitators or consolidators, bridging leaders, and partners basically. So forgot to move forward with the photos, no? So during their interactions, kinailangan namin tanggapin. So these are photos with some of the fisher folk, no, who were affected specifically dahil they are still are rising up, no, from the effects of Odette in 2021. So they're still recovering, no. And during our interactions with them, the more na nakausap namin sila, the more namin na acknowledge na we are working in a diverse ecosystem, no? Hindi kami nag-iisa at hindi kami lahat, even tayo, no, sa mga projects natin, no, as students, as SKs, hindi lahat pare-pareho yung interest, hindi lahat pare-pareho yung expectation. And nandun pumapasok, I think, yung work of leadership, no, that we can practice. Now, while the school has curriculums, yung mga eskwelahan natin, may mga curriculum that will guide us, pero yung pag-solve ng mga totoong problema or ng mga wicked problems that we call in society, parang walang manual yon. There's no strict manual for that. So, as we pursue this project, our capstone project, no, we are learning how to act on the fly, to experiment, to reflect, to sense our environment, and to keep moving forward, acknowledging that that's the only way to go and to grow. So as fellows, it may feel uncomfortable. Like ako personally, parang before coming into this lab, akala ko dapat yun nga, structured na yung solution, which is in the real world, that's not how it works. So it is uncomfortable being in the middle of a problem and the best solution. But I am learning that the best solution is the journey taken with all these people, no? Hindi lang in our classroom, in the four corners of our classroom, but with the people around us. And it involves taking a step forward, step back, pausing, running, and even sometimes changing direction according sa pangangailangan, no, and according din sa solutions na ibinibigay din ng community sa amin. So and I feel like no, this is how addressing challenges in a VUCA world would really looks like. Diba? It's vulnerable, uncertain, complex, and ambiguous yung mundo natin ngayon. And it will take these kinds, I think, of lessons na to approach these problems. So it's how addressing challenges in a VUCA world feels like, I think. And these are the things that we need to learn and welcome. So the Civica Social Labs help prepare us for that by giving us this good avenue to experiment with different solutions and learn from different people and experiences. So actually, this I'm just showing several of our photos with the farmers, with the fisher folk, um, with the SNSU. Here are our photos with Mayor Coro and his staff. And ito, yung mga fisher folk who are still recovering from Typhoon Odette. And we are helping them or helping design a business model for the Climate Field School para tulungan sila na to sustain their initiatives as farmers and to also build yung food security nung municipality and nung island eventually. So this is the Climate Field School na destroyed din siya nung Odette. And so there are a lot of uncertainties and it's a privilege na we get to work with the people in the community to address yung mga uncertainties na yon. So ayun, so they have new projects and things like that. So that's it. That's my experience as a Civica Lab Fellow, and I hope na that was inspiring for those who want to take on this initiative as well. Thank you.
Thank you so much, Miss Kim. Hold on. All right. That was indeed inspiring, Miss Kim. If you can do it, then of course our participants can too. And you made it feel like anyone can do it. So thank you to our panelists for sharing their knowledge and their experiences. We are all in awe for what you have contributed. I'd like to ask everyone who are in here to turn on your videos. And for our participants in the live, you can comment your questions down our live. And here in the Zoom, you can raise your hands and we'll unmute you if you'd like to join in the discussion. Okay.
Yeah, for the discussion, maybe we can start the discussion. Question for Kim, no? So you grew up in Bicol. I don't know where you went to high school, and ganyan, no? But this lab thing, social entrepreneurship, hindi ito typical na methodology. And even we were not taught about this when we were at school, and malamang yung mga teachers rin, no, sa senior high school, sa college, hindi rin nila ito alam, no? So how do you think, how might we build up an army or a network of instructors and coaches? Yeah, this question also for Kevin, no? Parang how do we build up hundreds or thousands of lab coaches, mentors, instructors, facilitators, given that we were not educated using this methodology. Yung methodology that we were exposed to was lecture, my textbook, the answer is fixed, and the teacher knows the correct answer, or it's at the back of the textbook. Diba? My answer guide, it's neat and well-defined. No? Whereas this methodology is something new for most of us. Paano nyo nakita to, and how might SKs, Sangguniang Kabataan, and universities and schools help move forward to introduce this methodology of learning and solving these problems?
Okay, Doc, thank you for that. Actually, when we were talking about this, I'm really excited for it kasi as you mentioned, we didn't grow up with this kind of setup. We have fixed problems, or like it has to be really scientific or things like that. And I think the way you put it with SKs, with the NSTP, putting initiatives like this, the innovation labs in the NSTP setup or in the NSTP curriculum would be really helpful. Kasi yun nga, experimenting with different solutions, getting into the nitty-gritty of the problem. It's a process, and I think the NSTP classroom is a great place to do that, to a great platform and space to actually help students, tell them na okay, we can listen to the problems in our community. Kasi NSTP we have if I remember correctly, the CWTS, the community, the LTS, and then the other thing is ROTC. So why not make it really relevant to where we are at present? So I think that's and also I've been working with the LGU for the past 3 years. And that's actually one of the things that I would talk about with my co-consultants. No, why don't, like, for example, give a grant to those students in our, because we have Bicol University Tabaco City campus, and there's social work there, there's nursing there. So, and I work in gender and development. So we were thinking before pandemic happened, why not we give a lot budget to give grants to students who are doing studies on this, and we will be part of the panel, or we will be part of the people who will help them formulate this. So I think there are a lot of there are avenues for that also in the local government.
Yes, Kevin.
So
Your
to
thoughts,
build on
you've been
that,
in this for many years. So, ano yung experience mo and insights mo on this?
for me, it's important. Well, right now, no, I've made one of my clients, no, or it's an academic institution, and I'm helping them build a curriculum on entrepreneurship, innovation. So what I realized is when I tap people who are not exactly professors, but people who are practitioners in what do you call this, in design thinking, to develop these curricula. I mean, it takes a different spin, no, na it's possible, no. So I saw the possibility, because when I learned these interventions, these approaches, I honestly learned it in fellowships, in leadership programs that are being offered in social media all around, no. So it's not really part of the of one's academic awareness and learning. So, and I think based on in the perspective of curriculum design, no, it's important to make their learnings be output based. Na okay, the grades are important, no, but in as part of the requirements, as part of the producing these grades, no, it's important that the students will be immersed in an experience rather than in concepts. So activation of concepts, seeing the reality behind the concepts. I think those are very important to get the students to realize that there's so much variables to solve in the equation, other than the frameworks I'm learning in an ethical lecture setup. So if they are immersed, placed in what we call a crucible, to, I mean, we can say that it's baptism of fire, no, for them, no, but it's going to lead them to think of innovation, think of new ways of doing things, and we don't have to stop them. No, so other than placing it as an output, no, for the students, create an environment wherein it's okay to make mistakes. It's okay to have different views. No, a safe space, not to be assessed by boundaries of grades, but for them um, to just think about how can these different concepts be combined so that we can improve, let's say, a social enterprise or a governance project or a strategic plan. So we can get inputs from various people from different backgrounds. So if we can create a safe space for them, then that will be great. So I think academic institutions can also be um, initiators, no, of bringing these mindsets, tools, no, in their respective curricula or programs there.
Thank you. And then, Kevin, I remember you have some experience working with companies who decided to tap to use a hackathon or a boot camp to solve their problem, no? Problems,
Yes.
come up with innovations to solve the problem of the company. How do you feel? Do you feel that is that too complicated for universities to do? Say, a university in Naga will say, oh, sige ho, ito yung problema nitong kumpanya dito. Pwede bang ipa-project natin sa mga estudyante sa local university dyan? Is it, can universities wing it, or can they handle it, or is it too complicated or too risky for a teacher or the university na to absorb a problem set like this na parang commission sila o magpa-hackathon nga kayo? Is it too complicated, or is it doable, or what needs to be done so that spaces like those can be done in universities, especially outside of Manila, because in Manila medyo may buzz na talaga ito, but outside mas manipis pa. So do you have any thoughts on that? And then maybe Kim rin, galing kang DOST, so actually ito dapat yung pinupush, di ba? DOST is pushing universities to solve problems, but so ano yung thoughts niyo on that?
Yeah. So recently we had a meeting with UP Los Baños, specifically the Department of Agribusiness Management, and most of the leaders there, even the department chair is millennial. So medyo iba I mean, the way it's fascinating when they were discussing about their programs, what they've been doing with their students. It's practically utilizing these partnerships, making their degree be an incubation program. So na-fascinate ako dun sa fact na there's a possibility and what they're doing is they're developing these hackathons to solve problems, let's say in their community, kasi agribusiness management and entrepreneurship, na they're required to develop a business. So what they thought of is, okay, this particular subject will instead of developing a paper on, let's say, a business plan, why not engage yourself in a process wherein you're interacting with mentors, with experts, and then whatever you join a hackathon, and whatever output that will be considered as an academic output. So it can be a risk if I mean, it's more of a the willingness of the faculty to tweak a bit of their syllabi, so that it can provide a space for students to do more immersion, to do more interactions. And even in the development of a technical thesis, or technical paper, if we can reverse it it's not just the coming up of thesis document, but it can be, using the same, changing it in such a way that it's more human-centric, empathy-oriented, na imbes na interviews, we do empathy exercises. So those things, those little tweaks in the way we do research, in the way we come up with outputs, those can be it's possible to integrate to have these collaborations with LGUs as part of the curriculum. So it's just taking that step and making sure that we veer away from what's the usual. So and siguro kaya ako binigay na example yung PLB kasi yun nga, yun yung naging drive to make the curriculum more progressive in a way from their old curricula. So it's possible.
I'd like to add to that, to what Kuya Kevin said. We actually had, before the pandemic, 2018, we also had the opportunity to do a pilot design challenge in a state university, and that was funded. That was through the Impact XL program of East West Center, where YCL is doing their fellowships. And the first few steps were really rocky because we wanted to do it in Bicol University as like a design challenge. We call it the Volcanomia Design Challenge, on how to translate or to make the threats of Mayon, create it into something that would become opportunities for people, because Mayon, as it's ongoing, it's active, and then all the time we have to relocate, to evacuate. There's always destruction in the agriculture sector. People are affected, so we want to rethink that and see opportunities on how people could adapt to that and even rise above that. And then we thought it was a really good thing to do, a design challenge for students of different backgrounds. So we wanted to do it university wide. But while I was talking with the administration, they also really have their challenges because it's an institution. So there are different processes, but when we know that grants like this, they have their timelines. So what we did, with my partner and I, what we did was to connect with, to scale it down first to the College of Engineering. So we found a champion there who really wanted to do this as well for her students, so Engineer Joy. And so we did that. We did that for, I think, around 200 or 300 engineering students. So they proposed their creative ideas, and Sir Kevin was there also to talk about design thinking. And so I think while that was really just a pilot in 2018, it was a good avenue for the students to rethink na, oo nga no, we could do something about this Mayon problem. It's not just something that we're like sitting ducks, ganon. So magandang na nakita nila. And eventually, while we were not able to do it at the university scale, and we just did it at the college scale, even at the college level, we also had challenges with the dean of the college because really what they really wanted to do was to present to us yung mga award-winning thesis ng students nila. And while that's a good thing, that's not the main goal. So eventually at the end of the whole thing, we presented the solutions of the students, and we invited even someone from the ISA Center to be there. Eventually, we gained her support, and she saw that this is something that could be done. So I think the takeaway from that is, while it is risky, it's possible, and maybe people just needs to see that it's viable, that it's exciting, that it really is what do you call this, relevant. And yeah, so that's the experience.
Thank you so much, Miss Kim. Okay, hold on. All right. Great. Thank you to our amazing panel. I hope we were able to provide you more clarity about this afternoon's discussion. And I know I have learned a lot myself. Thank you to our panels. I would like to give the floor back to Dr. Elmer to finally close this event and for his last thoughts as well. Dr. Elmer?
Okay. Thanks, Lara. Thanks to Kevin and Kim for their sharing, and si Doc Apons Belmonte for their sharing this afternoon. Now, as I was listening to our conversation, I remembered nga na this SK, yung SK kasi, di ba, Sangguniang Kabataan Elections, it's actually, to my mind, it's the largest leadership school that we have in the country. It is like PMA, Philippine Military Academy, except that it is spread across 40,000 plus barangays, where we have young Filipinos ages 18 to 25 years old signing up, filing their candidacy, and then having to do real work, to real world problems. And I think it's a wonderful opportunity for us to equip the next generation, the current generation of young leaders. And one principle in leadership development kasi is give the work back to the people. So even as SKs, the SKs do not have to solve all of the problem themselves. SKs, the leadership of SKs can be deployed by creating the space for hundreds or thousands of youth, hindi mga SKs, kundi mga estudyante sa colleges, sa senior high schools, na maging bahagi ng solusyon by picking their brains, mobilizing the brain power of the students to solve problems. And if the next generation, the young generation of leaders begin to recognize na lahat pala tayo pwede maging problem solvers, hindi lang yung mga nahalal. At yung trabaho ng mga nahalal na leaders is yayain yung sambayanan na maging kasama sa kabahagi sa pagsosolve ng mga problems natin, then we will be a nation of problem solvers. No, hindi tayo biktima ng mga problema, hindi biktima ng mayon, kundi nakikita natin mga events like a volcanic eruption as an opportunity to come up with innovative solutions. No? And thanks Kim for that little anecdote. No? Parang nakakatuwang pag-isipan na nga, no, pwedeng maging opportunity yung active volcano. So we're hoping that the next generation of young leaders, this crop of young leaders, will be able to create spaces for the rest of the Filipino youth to become problem solvers alongside the elected leaders and alongside their teachers and school administrators. So thanks everyone for your contribution. Thanks to Kim and Kevin and Doc Carlo Belmonte and Lera for your participation this afternoon.
Thank you.
Thank you, Doc. Thanks, Miss Dara.
Thank you, everyone. It was so nice meeting you all.
Okay, thanks. So that wraps up our afternoon's event.
Yay.
And we're looking forward. We hope this video gets circulated. We're planning to circulate this video more broadly, and then we're planning to catch the wave of newly elected barangay officers para makita nila na kakampi pala ng mga barangay, mga schools and universities in solving problems. Thanks, Kim. Thanks,
Thank
Kevin, and thanks,
you.
Lera.